Dr. Nick Winchesianas, and I work at the Texas Center for Disability Studies. And I have an amazing sister who also has an intellectual disability and Crohn's disease. So she is considered vulnerable during this pandemic because she is immunosuppressed. So thinking ahead of what needs to happen if she is admitted to the hospital with COVID-19 symptoms, is using a one-pager, or in this case, a two-pager of the most basic information that would allow for her to communicate to her doctors and her doctors to communicate with her, and also for her to feel safe. So in this document, I have used myself as a model to keep her privacy. So I put name, what her preference for her name is, whether she is her own guardian or if she has another guardian. If she had a supported decision-making agreement, I would put that here as well and who those folks were. And I would probably attach that agreement to this paperwork. And where she lives, and if it's her home, or in this case, it's our parents' home, a picture, who our parents are, their phone number, who I am, and my phone number, current health issues. So I'm thinking of diagnoses that are currently affecting her. I also put needs here. So these are needs that would be absolutely necessary for her to communicate to doctors and nurses and other personnel. So here I put, I need my hearing aids to hear and my glasses to see. Please use plain language, which is clear, straightforward expressions, only using as many words as necessary when talking to me. I have a list of medications and how to take them. I also put in here things I do like. And I think that's really important when we're talking about maintaining safety and health. So if someone is going into an unsure environment with a lot of chaos and is not able to have family or friends there, or people that they trust or support, if it's possible to have something blue, if it's possible to have something there like apple juice or mac and cheese, something, or people talking to me and making sure I understand, those kinds of things to at least negate any additional health concerns that might happen because she's so nervous and scared. Things I do not like, again, the same reasoning. So thinking about not being able to do what I want, or being talked about, people invading my space or touching me without asking, being ignored, loud noises, being alone, all those things might actually cause her Crohn's to act up. And so these are things that I want the medical staff and personnel to know ahead of time and know that that is something that might be a trigger. I put on here, when I'm sad, this is what it looks like. When I'm mad, this is what it looks like. When I'm scared, when I'm happy, and when I want to calm myself down. Again, I think this is all extremely useful for medical personnel and staff and support staff to know in this chaotic environment, just to look at this and say, you know what, this person is just having a really hard time and we need to figure out how to make her feel safer and more comfortable. These are different things of like what that looks like and how to do that. Again, this is just the most basic information. I did this because I'm really nervous about my sister having to go into the hospital with COVID-19 symptoms and not being able to have any supports there that know her or are able to communicate with and for her. So I've done this. Many providers and professionals are suggesting this for folks who support individuals with intellectual and developmental disabilities or communication challenges, whatever it is. So creating this, I've created this with her. I've had her input on this of what's important to her and best ways to make sure that people are talking to her and communicating with her. So this is something that I would suggest. This is going up as I just made this, but you can also, there are templates out there for one-pagers or two-pagers and what that looks like. And we're going to have those available as well. But this is something that I'm doing, and I think that it's really important for folks to keep this in mind. I also created some medical paperwork. So in Texas, we have an advanced directive paperwork on our Health and Human Services website and different powers of attorney that are available there if we don't have a supported decision-making agreement in place. So filling that out with her and making sure that that is available with this paperwork as well to give to the medical personnel and doctors in case it comes to that, just to make sure that our loved ones are as supported as we can possibly have them be at this chaotic time during the pandemic. So hopefully this was helpful. Stay healthy, stay safe.